And now a health crisis is looming at the Pumwani Maternity Hospital after medical staff at the facility staged their go-slow, protesting alleged lack of personal protective equipment. The development coming as 41 workers at the country's largest maternity hospital, including 19 medical staff, tested positive for COVID-19. Acting Health Director General Dr. Patrick Amoth, who led a delegation from the Ministry of Health to assess the situation at the medical facility, said an isolation center dedicated to the hospital staff had already been set up. Meanwhile, health workers are expressing opposition to the proposed amendments to the Health Laws Amendment Bill 2020, saying the proposed alterations are not in the interest of health workers.
Last Friday, the country received the news of the death of Dr. Doreen Adisa Lugaliki, who succumbed to COVID-19. Dr. Lugaliki, who until her demise served as an obstetrician and gynecologist at the Nairobi South Hospital, became the first health worker in Kenya to succumb to coronavirus, a deadly pandemic that has put millions of health workers at risk as they remain in the front line. Just a few days after the sad episode, another 41 positive cases of COVID-19 have been reported at the Pumwani Maternity Hospital in Nairobi, including 19 medical staff working at the facility. Speaking after he led a delegation from the Ministry of Health to assess the situation, Acting Director General of Health Dr. Patrick Amoth said that the cases were reported after screening samples from 290 staff at the facility in a targeted testing exercise.
Out of the 41, 19 are healthcare workers, frontline healthcare workers, and I think 21 or 22 are support staff, ancillary staff from revenue, kitchen, CSSD, and the like. And all these people are under home-based care isolation. None is under institutional isolation.
Anxiety had gripped the medical facility, with the DG assuring that an isolation center dedicated for the staff had been set up as part of the precautionary measures.
And I've been assured that we have sufficient quantities of PPEs, personal protective equipment. Further, we have agreed that beginning today, we'll have an isolation center dedicated for staff of the hospital at the School of Nursing for those who may not meet the criteria for home-based isolation.
So this to assure the members of public that Pumwani is not closed, because the percentage of those who are positive was very low. But what we have done is we have scaled down the services.
Operations at the facility had been affected after medical staff stayed a go-slow, protesting lack of personal protective equipment in the wake of threats posed by the coronavirus pandemic. Meanwhile, health workers in the country have opposed the proposed amendments to the Health Law Amendment Bill of 2020, which they say seeks to, among others, amend several health regulatory laws.
As we are all aware, the government has continued to mutilate the laws in the labor movement which govern the workers in this country. And as we speak, the government has engaged again in another war with the healthcare workers by proposing very draconian amendments to the laws governing the regulatory bodies for the healthcare workers.
The acts that are proposed for amendment, I will just highlight a few of them. One of it is the Clinical Officers and Registration Act, number 20 of 2017, the Nurses Act, Cap 257, the Medical Practitioner and Dentists Act, Cap 253.
They are also opposing a proposal to remove the Director General of Health from the regulatory bodies and have him replaced with the Principal Secretary in the Ministry of Health, terming the move as an attempt to mute the voice of the health professionals in the country.
This shall deny the professional regulatory bodies the benefit of the Director General as the technical advisor in all the regulatory bodies and councils.
For Channel One News, I'm Safin Aching Oma.